What would you do if a life-saving medication for your child cost $4.25 million? We are tracking this groundbreaking news out of the medical world, bringing new hope to families who are battling a deadly disease. Last week, the FDA approving the first gene therapy for a disease called metachromatic leukodystrophy, or MLD. It is a rare, progressive, and ultimately fatal disease which impacts children under the age of 7 by attacking the nerve system. Now, some of the symptoms of children who are diagnosed with MLD are losing the ability to detect sensations, move, or talk. This new drug, Lenmeldy, holds the potential to stop or slow the progression of the disease with just a single treatment. But the life-saving treatment comes at a staggering cost, that hefty price tag of $4.25 million. And to put that in perspective, that is 66 times the average American household's annual salary, making it the most expensive medicine in the world. Now, this news was bittersweet for one Phoenix family. Kendra Riley is a mom to 3 beautiful girls, 2 of them, Olivia and Keira, both diagnosed with MLD. Now, they found out that Olivia has MLD at just 2 years old, but because she was already showing symptoms, it was too late for her to receive any gene treatment. But the family knew the condition was inherited, so they were able to get Keira tested and diagnosed before any symptoms began. Because the treatment was not available in the U.S. at the time of Keira's diagnosis, the family made a dramatic move. They went to Italy in 2020 to access treatment. Keira was the 32nd child in the world to receive this therapy. And we're now joined by Kendra Riley, live now, mother of Olivia and Keira, diagnosed with MLD. Thank you so much for making the time this evening.
Of course. Thanks for having me.
So you're the mom to these 3 beautiful girls, 2 of them
Mhm.
diagnosed with MLD. First, let me ask you, how are your girls doing?
They're very happy. They're all outside playing together in the backyard. They're on Livy's Make-A-Wish swing set as we speak.
Tell me about Keira. What has it been like since she received the therapy, the treatment?
Since Kira received the therapy, she has shown absolutely zero symptoms.
Wow.
It's honestly been a miracle. Yeah, it's just watching her develop every single day is amazing, and we're so grateful that we got her to Italy when we did.
And unfortunately, it was too late for your older daughter, Olivia, to receive this treatment. How has that situation affected you and your family? How are you coping with this?
It's heartbreaking, obviously, but I think we're turning, our heartbreak into this advocacy work, and we're trying to make sure that no other family has to go through this. Now that there's this therapy and hopefully followed by newborn screening, that would prevent any other family from having to lose one child in order to save another.
Talk to me about this cost. It is now the most expensive drug in the world, $4.25 million. Even after insurance, what kind of cost are we talking about for families? Is this realistic?
It'll be interesting to see. I know there's negotiations that go into it when they speak with the insurance companies and Medicaid as well. So I don't think that will be the end all be all price. It's more the value. But I also, would say to insurance companies to keep in mind how many millions of dollars it takes to keep these symptomatic children pain-free and alive, even to age 6. Some live to age 8, 12, 15. So in comparison, I think it's going to be a comparable cost to keeping these kids alive by age 6 or giving them a normal life for the rest of their life.
What is Olivia's prognosis now?
It's hard to tell. She is in hospice, and she did decline very quickly after symptom onset. So average age is 6. She's 5 now. So we just keep her happy and comfortable and pain-free every day and enjoy her as much as we can.
Talk to me about the strength that you have, your message for other families who are going through this. I am just struck. I cannot imagine what you've been through. The decision to move to Italy just to try to get this life-saving treatment for one daughter, not being able to have it as an option after seeing how life-changing it's been for Keira. How are you doing? What is your message for other families?
It's heartbreaking, of course, and I've never met a stronger parent than an MLD parent. This community is amazing in what they go through on every daily basis just to get through and keep a smile on their face for their children. It's incredible. But we're parents. We will do absolutely anything for our children, and that's what we did. We had 1 month's time to raise enough money to move to Italy and make sure she could live a normal life, and that's what she's doing. It's amazing, but like you said, it's definitely heartbreaking to not have that option for Livy. So that's why we're doing what we're doing, and we testified with the FDA, and making our voice heard so that hopefully no other family has to deal with this.
Yeah, and we're out of time, but in just one sentence, your message to insurance companies and drug companies about accessibility, this needs to be available for people without that huge price tag.
It does. I would say consider the millions of dollars you're already putting into keeping these children alive by the age of 6. I think it would be a no-brainer to spend the same amount on saving a child's life and saving a family.
Kendra Riley, I admire you. I appreciate your time. Wishing you and your family all the best. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.